Good afternoon. It is Tuesday at 4 o'clock, the time we come together this week for our COVID update. And today's update is going to move pretty quickly. Let's start with some really great news. Yesterday, we hit a big milestone of 2 million Kentuckians that have now been vaccinated. That is 2 million, a little more than 2 million Kentuckians that have gotten at least their very first shot of hope. And when you look at this, when you think about it, it is just a miracle. 15 months after the first case here in Kentucky, not only do we have effective vaccines, but 2 million Kentuckians already being vaccinated is really exciting. So let's look at Table 1, which shows vaccinations through the state. We are actually at 2,006,742 Kentuckians. That's because the Tiberius, the national system, updated. It had about a day and a half in it. But if you look at Table 2, what we have seen since this was opened up, since Pfizer was opened up to 12 through 15-year-olds, is a significant increase, not quite a doubling, but pretty close to it, of the numbers of people vaccinated last week versus the week before. Last week here in Kentucky, 74,553 individuals vaccinated. Very proud of this last week, and we want to keep it up. When you think about the fact that this was the first full week last week that 12 to 15-year-olds could get vaccinated, and many of the clinics that were set up to get especially middle schoolers and high schoolers are this week. Hopefully we will have two very good back-to-back weeks. Now let's look really quickly at our top 5 counties. I want to congratulate Woodford County. Now 60% of eligible individuals in Woodford County receiving at least their first dose of the vaccine. They pulled away just a bit from Franklin County, which used to be just 1 percentage point under. We've seen some upward movement from Fayette County. Good work. And then both Scott and Boone County there, each over 50%. When we look at Table 5, if we have it, just a couple of good numbers here. Hopefully you can see it all. 65-year-olds and up, we're now 81% of all Kentuckians 65 and up that have been vaccinated. 61% of Kentuckians 50 to 64. That number is increasing. We'd like to see it get better. 47% of Kentuckians 40 to 49, 42%, 30 to 39, 31%, 18 to 29. Again, we need to do better, especially in our younger age groups. As we'll see today, our incident rate is much higher among younger Kentuckians than older Kentuckians, and it's directly associated, we'll be able to give you some numbers here in a minute, with whether you're vaccinated or how much of each subpopulation by age is vaccinated. Thus far, we have had, looks like 23,409 12 to 15-year-olds that have been vaccinated since we had the ability open up to them. And we want to keep that up. So let's look at where our vaccine openings are. These are the ones that have the most appointments available. And when you remember, this weekend, Memorial Day weekend, there's going to be more capacity at everything, especially things that are indoors. And then June 11th, it is really close to back to normal. And in most everybody's life, it will feel like fully back to normal. But if you are not vaccinated, if you are vaccinated, again, we'll show you some numbers here. Folks, everybody has the opportunity before to get out there, to get their vaccine. And let's show you exactly the patient death by month chart. Sadly, when we were losing the most, we had that initial outbreak we knew about at the time. And then we were able to flatten the curve a bit. Then we had the summer period where it rose again. And then we had, some of the deadliest 3 months, at least in my lifetime, November, December, January, which happened all over the country. But then look at what has happened. December 15th, we get our first vaccines. Roughly 3 weeks after that, if you think about it, 5 weeks is when people get fully vaccinated. With 2 weeks after that, we get through all of our long-term care by the end of February. And look at that chart. The fact that we go from just devastating to almost to where you can't see it in May, though May is obviously not over, with huge declines, huge, when vaccinations are really occurring, especially January to February to March, shows you that these work. They show you should really get the vaccine if you haven't. Couple of numbers that prove it. March and April. These are 2 months where a whole lot of people had the opportunity to get vaccinated and become fully vaccinated. So when you look at overall cases in March and April, 97.5% of everybody who tested positive in March and April were unvaccinated. So that means just 2.5% of people who tested positive in March and April were vaccinated. Same thing in hospitalizations. 94.3% of all Kentuckians hospitalized for COVID, March and April, unvaccinated. 94.4% of all deaths in March and April were individuals that are unvaccinated. These things work. These things work. Yes, they are not 100% effective, but when you look at these numbers, they are much more than 90% effective. Folks, these vaccines have earned an A, and we all ought to recognize that and take them. Those are incredible numbers that show just how effective the vaccines are. Speaking of that, Moderna, new vaccine news today. Today, Moderna announced its COVID-19 vaccine in early trials is 100% effective in their study of adolescents ages 12 to 17. This is the age group, at least 12 to 15, that Pfizer has already gotten the emergency approval on. Right now, Pfizer is the only vaccine for ages 12 to 17 that have been approved. So Moderna now says it's going to seek that FDA emergency approval to expand that emergency use so teenagers can have 2 options so that there is more supply out there for them. Remember, Pfizer, you have to have that really cold storage. Moderna, a lot easier to store. So if this happens, if Moderna is ultimately approved, what it'll mean is there will be more places that can vaccinate Kentuckians 12 to 17. And I think that's really important, especially as we try to get all of our kids vaccinated before they head into the next school year, so we could have a fully normal return to school. All right, in other news, in-person visitation will resume at all Department of Corrections state prisons and Department of Juvenile Justice facilities the week of June the 20th. Visitors must schedule a visit in advance prior to arrival. Contact information for scheduling visits will be posted to the Department of Corrections and the Department of Juvenile Justice's websites on June the 4th. Each inmate and youth housed within custody will be allowed 2 visitors at a time due to different social distancing requirements. All visitors must provide proof of a completed COVID-19 vaccination card, wear a mask, and practice social distancing at all times during the appointment. Remember, this is a setting where if there is a COVID outbreak, we have seen that it can be devastating, how quickly it can spread. So we are taking precautions while still opening up visitations. There will be a number of different checks as you come in. Virtual visitation will be continued to be offered so that those not vaccinated or who don't want to wear a mask can continue to do those virtual visits with their loved ones. As of today, 76% of adult inmates housed in state custody have been vaccinated. And so to those in custody, good for you. Good for you. I know you've seen the harms of this virus, and thank you for responding in such a responsible way. Department of Corrections is going to continue to offer the COVID-19 vaccine to all individuals at the time of intake and for any inmates who have declined and now want to change their mind. Again, DJJ, which has some younger folks in their custody, is working to get the consents to vaccinate the youth within their custody who are 12 years and older. Just as a reminder, these are state institutions. This doesn't apply to county jails because the Department of Corrections does not operate those. All right, when we look at our kind of week-to-week COVID reports, which we've been providing normally on Mondays, today it's on a Tuesday. Good news is we have now had 3 straight weeks of declines. They are not especially large, but still the trend line is going down again. We ought to be very grateful and excited about that. In this week, as we'll see right now, is on pace, if it holds, to be lower than the last week. Just as important, when we look at our test positivity, that is also now seeing 3 straight weeks of decline. The decline this last week versus the previous week is smaller than the week before that, and that's something that we're just going to have to watch. Today's COVID counts, 580 new cases. That's the lowest Tuesday report in the last 3 months. Our positivity rate down to 2.52%. When we look at the incident rate, highest incident rate is 10 to 19 years old again. So if you're wondering, if you're 12-year-old, you're 13-year-old, all the way up to when they're gone from the house, need to get vaccinated. Right now, it is the group that is getting COVID the most. They're closely followed by 20 to 49-year-olds. So if you're like me and you're in one of these groups and you're about to have at least one kiddo that moves into the vaccination range, you really need to get vaccinated, folks, to protect them. Remember, you don't have to take the information from me. Talk to your doctor. Talk to some people this weekend about their concerns and had gotten some misinformation that had been out there. And again, what I encourage them to do after telling them that I thought it was safe and that I'm going to get my kids vaccinated when they're eligible is to talk to their doctor, somebody they already trust and can give them the information that they otherwise rely on for every other vaccination. Today, we have 5 total new deaths. 4 are from our local health departments and the way they report them up. These are all May deaths. It's a 65-year-old woman from Jefferson, a 57-year-old woman from Kenton, a 64-year-old man from Lewis County, and an 81-year-old man from Lewis County. And then the audit death is from November. It's a 58-year-old man from Pike County. Okay, I said we were going to move fast today. With that, we will move on to questions. We have a very large group, so we're going to have to limit it to 1 question apiece. If you ask a couple questions, I'll answer the first one and then smile. Debbie Yetter from the Courier-Journal.
Hi, Governor. Today, Jefferson Commonwealth Attorney Tom Wine announced there would not be any charges related to the shooting of David McAtee last year and some of the disturbances following the racial justice demonstrations. Do you have any thoughts about that outcome in that case, since Kentucky National Guard was involved?
Well, first, it's tragic anytime a life is lost. Mr. McAtee was loved by the community in which he lived. I believe that the public should be able to see the full analysis of Tom Wine. I believe that it is very thorough, but presents a lot of information that the public can then analyze and ultimately come to their own conclusions. But I think what it will show people is that a lot of time was spent to make sure that the facts could be uncovered. And I think those facts need to be presented to the people of Kentucky. Alex Akisto from the Lexington Herald Leader.
Hi, Governor. Do you think your popularity among Kentuckians has decreased over the course of the pandemic? And how will you work to bring back trust among people who may have disagreed with some of your restrictions as you look toward the remaining years in your first term as governor? Thanks.
I've never been worried about my popularity throughout this. When this pandemic first hit, I was looking at projections that we would lose in the moderate projection up to 80,000 Kentuckians. And knowing that even if in an attempt to have a laugh during a difficult, scary time, people were making memes or anything else, I was in my office trying to make plans for what happens when our hospitals are overrun, doing my best to calm people's fears about whether there would be food in the grocery store. We were trying to find testing capacity so we didn't have to tell folks that unless they're really sick, don't go get tested. And I was working all the way up to when we would start these briefings on trying to find PPE from anybody so that people could have it. But I made peace early on that I wasn't going to make one political decision during this, and we were going to base everything on life and death and the science. And whether that means popularity is increased or decreased, whether it will help or hurt me in the future and in staying in this job, that's just not how you can approach a pandemic. I don't know how I would have ever been able to look somebody in the eyes who lost a family member if we hadn't made decisions the way we had. I think those that disagree. But I think we've been strong when we've needed to. I think we have been decisive, and hopefully people can respect the genuine place that these decisions have come from. Again, moving forward, my goal is to continue to leave all the political calculations in the past. We've got amazing economic opportunities ahead of us, and if we're going to truly have prosperity for everybody, we can't be fighting because it's good or bad for one party or the other, and we can't try to politicize important decisions we've got to make for our economy. We're coming out of a 1 in every 100-year pandemic. We're about to move into a once in a generation shot at economic prosperity, and we got to make sure everybody gets to be a part of that. Karen Czar from WKY.
Good afternoon. Governor, since the onset of this, we have always looked at large events as being potential super spreaders and how the virus is traveling. And not only here in Kentucky, but national outlets were looking at the Derby several weeks ago as an indicator that we potentially have turned the corner. Here we are 3 weeks later. Our numbers did not only level, they're going down. Are the results a good indicator, and does it give you increased confidence in the restriction changes that are ahead? Thank you.
Thank you. It may be still a little early to see the impact of Derby, but you're right. It's 3 weeks after. Our cases have continued to go down. I think what we are seeing is more real-world proof of how effective these vaccines are. I think we are also seeing the proof about how being outdoors is safer than indoors. I think these vaccines are a miracle from God. I do. In our darkest hour, in a period of time where COVID had become the third highest leading cause of death in America, when we were seeing losses in our country that others weren't experiencing, here they came. And as I've read the numbers today, they can not only fully end this, but they also offer such amazing protection to those who are willing to get vaccinated. So thank you to the 2 million plus Kentuckians that have been there already. We got more work to do, but that's really, really exciting. And I think I missed one of the most important numbers, which is of our adult population now, 56% of Kentuckians have received at least their first shot of hope. Stu Johnson, WEKU.
Thank you, Governor. Good afternoon. You mentioned in your remarks that I'm looking for the figure now, the 10 to 18, I think, were in terms of the incidence rate of cases right now. So of the 580 that you reported today, do you know roughly what percentage are children under 12 years of age?
We can get you that number. I don't have it up in front of me, Stu, but we can email you the exact number today of kids you want 12 and under. We'll send that to you. John Boyle from WFPL.
Hi, Governor. You were showing the chart about some of the younger populations boosting our vaccination rates this week, but we still have had trouble with some of the older groups over the past few weeks. So we've seen some of our states, particularly to the east, offering things like sports tickets, lottery, cash payments, savings bonds. And I was curious to know if the state would consider, offering any more incentives to boost that vaccination rate in older populations.
Absolutely. And we're looking at that now. We've offered lottery tickets like some others have. We've had private incentives that have been offered in a number of ways. We're trying to work with our managed care organizations because they ought to be offering more incentives than they are with their populations. And if you look at 90+% effectiveness of vaccines, keeping people out of the hospital or dying, it's an inexpensive investment to provide those incentives. But yes, we are looking at everything that anybody else has done, and we're looking at what we can operationalize and what'll work. And listen, we're open to any idea. All we care about is saving lives and getting as many people vaccinated as possible. Looks like a lot of what Ohio is doing is working. What Maine is doing is really kind of localized to Maine. I mean, a lot of it's LL Bean gift cards because I think LL Bean is there too. But looking at all of them, and I hope that we will have some news as early as next week about some new programs to encourage everybody to get vaccinated, potentially reward those that have already been vaccinated. Tom Latek from Kentucky Today.
Thank you, Governor. This is a question about Sunrise Children's Services. Their attorney says that he called Health and Human Services for a waiver as he was instructed to do so by Cabinet for Health and Family Services Attorney Wesley Dukes. And in this conversation with Washington, found out that the regulation hanging things up was repealed during the Trump administration. Were you aware of that? And is there anything else that stands in the way of providing Sunrise that accommodation that they've had for the past 20 years or so? And I thank you, sir.
So my understanding is it was not repealed. There was a notice of non-enforcement, which is interesting. It says there's a regulation on the books, but we're just not going to enforce it. There was a rulemaking process about replacing it, and then a new administration came in. What we've been told is that new administration should have a decision on the future because they could change that notice with as little as a signature by the end of August. And again, just trying to follow federal law, putting our kids first. I think giving it the time to get to that ultimate decision means that folks aren't arguing over the next couple months and then having an ultimate decision coming down. Our goal is to follow federal law. But let me also say that I think that as far as foster parents go, that it would be a mistake not to place kids with wonderful couples that want to be foster parents that are gay. I believe that people make wonderful foster parents in all types of couples, and we shouldn't be eliminating or discriminating against any of them. Catherine Collins from WLEX.
Hi, Governor. My question is on unemployment. We recently heard from a Lexington business owner who said he received a notice from the unemployment office asking him to break down daily hours worked over a 6-month period for some of his employees who'd filed for unemployment. and he was just frustrated with how much work this requires, especially because it only gives a 10-day time limit. How do you respond to these frustrations? And is this putting the responsibility of preventing fraud onto the employers?
Well, fraud is a serious issue, and I'm not sure how those that work in UI would determine the number of hours worked without going to that employer. Now, when criminals try to defraud Kentucky and the rest of the country, it can put a lot of work on everybody. So we'll look into that situation. But I also don't think that our employers want to bear any additional expenses for unemployment payments that shouldn't be made based on people that may or may not qualify. But that's the first time that I've heard of that issue. So we'll take a look at it. Joe Ragusa from Spectrum.
Hi, Governor. I also have a question about unemployment, and specifically, I've talked to a few people, unemployment filers, who have had issues with identity verification, kind of specifically after the recent shutdown of the website and the kind of overhaul of the security and all of that kind of stuff. I want to ask you, and I forwarded the specific cases to your office as well, but I want to ask you kind of a twofold question about this. Do you know kind of how significant is this issue with identity verification, and how many people are facing that specific issue, and what is being done to kind of help people in this specific circumstance?
So the challenge in getting the number you're talking about is we stop the fraudulent claims because they can't provide the identity, and then there are also some who are struggling to provide their identity. All we have is one number that would include both. And again, it was absolutely necessary, because without the extra steps we've now put into place, these criminals were coming in and actually changing the bank accounts of individuals who were receiving unemployment. That was stealing their money, and that was stealing the state's money. And the only way to prevent that from happening from these sophisticated hackers, many, maybe most of which are overseas, is these extra steps. I mean, I hate that it's any harder on folks, but this is what the criminals have done to us. Julie O'Neill from WCPO. Oh, okay. Melissa Patrick, Kentucky Health News. Okay. Is she back on?
Oh, hello, Governor.
There you are.
Can you hear me?
I can.
So the latest state report shows from 27th to 31st in the last 3 weeks for fully vaccinated people. Why do you think that is, and what are we doing to get Kentuckians fully vaccinated?
Let me. Do we have Dr. Stack on the line? Let's go over to Dr. Stack for that piece. We have seen, just like a drop off in fewer people coming in to get vaccinated, that we had a big increase this week. You also see somewhat of a drop off in folks getting their second shot. We work to schedule that second shot at the time that people get their first one, and I know the providers follow up with them too. Steve?
Governor, can you summarize the first part of her question for me again? I understand there was a fall-off question.
Yeah, Melissa, you want to ask it again? We did have a hard time hearing it. I think it's, are we seeing, and I think she said we have seen, a lower amount of individuals coming back getting their second shot in the last couple of weeks. Have you seen that in the data?
And the CDC just shows us ranked 31st for that, and that we keep dropping a slot every week.
Gotcha. So thank you for the question, Melissa. This is something I can probably come back with a little more detail on a subsequent visit, or we can get you more detail, but adherence is important. So coming back for the second dose is obviously very important. And so thanks for highlighting that. We have had probably in the ballpark of 90% follow-up, but that varies depending on region and time. One of the things we would be concerned about is as people look around and see activity resuming and they think things are back to normal, that people may say, you know, I don't need to go back for the second shot. And that's not correct. In order to get the full protection, in order to have it last as long as it can, you've got to go back for the second shot. So your observation that there may be a bit of a decline, I think is probably reasonable. And it's something we need to continue messaging to all of the public about the real importance of coming back for that second shot. So thanks a bunch. And, you know, we'll keep following that and we'll keep encouraging people to see it through the entire vaccination series. Governor?
And all I'd add is with the exception of the new group, kids that became eligible to get vaccinated, we're at a population that, as we've all seen, is a little bit harder to get in and get the vaccine. So it's going to be a little harder to get in and get the second dose. But like everything else, we've got to try anything and everything, and any idea will be considered. And we're willing to steal any good idea that other states have had. Andrea Ash from WHAS.
Thanks, Governor. So a couple questions on unemployment. Are you guys considering ending the state's participation in the federal supplement program with the extra money? And then on a different line, we've been told that only one specialist has like the powers to process federal claim workers' claims. And just wanted to fact check that and how many specialists are able to process those claims. And then lastly, we continue to hear from quite a few people about their in-person appointments where they're told, hey, your claim's been fixed, only to go home and not receive any money for weeks and weeks. And just wondering, what are their options from here? What can they do?
On question 2 and 3, we'll get you a written response. On the first one, it is critically important on these extra benefits that we don't fall in a Democrat or Republican debate, not a red state or a blue state, but we look at the actual economy and make the very best decisions we can. I have already been on record as saying that we've got to make sure that our recovery is sustainable. Remember, Moody's says we're recovering with gusto. Fitch's says we're having a strong economic recovery. Our recovery is outpacing certainly the national average, and we want to keep that up. Consumer spending is one of the lifebloods of our economy and certainly our economic resurgence. Those extra payments are $34 million coming into the Commonwealth every week, just about all of which is being spent. Number one place it's being spent is on groceries and then on retail. And then we're seeing it in our restaurants. So many of the hardest hit areas, part of their resurgence is because of these extra dollars flowing through our economy. Now, that doesn't mean we necessarily keep them all the way through September. It means we got to thread the needle to make sure that we do not shock our system too early, because there have already been some reports from economists about what could happen if that was the case. There is also some economists who are saying that simply cutting them won't return a specific number of people to work. So we've got to make the wise decision that makes sure we continue to increase our workforce. And we added 1,900 construction jobs last month, this month, last month versus March of 2020. We've added, I think, 52,000 hospitality jobs. So people are coming back. But remember, our economic resurgence is especially large these last couple months. We had the largest sales tax month ever in the history of Kentucky in April. Many people are out and spending. Now, you're not going to get people back to work in 3 weeks of an exploding economy as quickly as we're seeing it heat up. So our goal is to make good, rational decisions, which we're going to do based on the economics. Chris Otts from WDRB with our last question.
All right. Thank you, Governor. Big picture question on unemployment. There are still unresolved initial claims that were filed in March of 2020 and in every month thereafter. And as you know, people are still frustrated. They can't get anyone on the phone. They have to stay up until midnight to have a chance at getting an appointment, which is weeks out. And as you heard, sometimes those don't result in getting their issues fixed. Last year, you were doing outside the box things like turning to Ernst & Young to come in and help. And correct me if I'm wrong, but the legislature gave you what you asked for in terms of the level of staffing, I believe, in the state budget.
Yeah.
So my question is, are there any further changes in the works to improve the level of service with unemployment, or is this basically the best that state government can do until there's a new system?
So the General Assembly did not give us any new general fund dollars so that we could grow in the long term that office to where it needed to be. They didn't return the $18 million of general fund cut in previous administrations, nor did they provide funding to make permanent the more than 90 positions they cut in the past. Instead, they allow us to use some one-time or time-limited federal funds to increase people now, but then to go back to levels that we know don't work. It is a failure to learn from what we've been through. And it means they'll give the next governor who faces something like this an inadequate staff too, even after watching what happened and even after complaining about parts of it. Certainly, we are finding new ways in our system to try to help people every day. Remember, we haven't been back to in-person offices all around the state for all that long. We believe those are by and large being successful. We're working for really large employers like the auto industry that are having shutdowns to be able to do those in mass with more flexibility than we've ever done before. But the one thing I can't change is the way that the overall laws and systems were designed. Remember, it's meant, sadly, to be complicated based on how it was put together, because it's put together in a way to get people frustrated and to get them to quit. So I was talking to somebody in Floyd County the other day and didn't know that once you got your letter that said you can be approved for a certain amount, you had to go online and register. And then after you went online and register, you had to request your first payment. And then periodically, you got to request every single other payments. Think about how many steps those are. And given that there are so many steps, people can make a mistake anywhere along that, meaning somebody we've gotten everything fixed for, then makes a mistake on the next one and needs to come back and see somebody. What that means is the laws are set up in ways with what we're seeing right now, where you're almost always going to be overwhelmed. The long-term fix is fixing the laws related to it. It is making sure that in the future, you don't have to go through all of these hoops that federal law makes you do. And looking long-term at whether some people who really needed unemployment that until the federal government opened it up, whether it's part-time or others, can get it when they do. Big picture, yes, we desperately need to update the IT system, and we hope we'll get a contract here soon, but we're trying to get it right. Long-term, we absolutely have to raise the permanent level of employees over there and the budget. But the big long-term picture is we've got to change the federal and state laws that create a frustrating, difficult system that's designed to make people quit trying to collect unemployment that they're entitled to. All right, everybody. So I just end tonight with, we lost a lot of people in this pandemic, both in COVID and from other causes. We lost David Turner Jr., a friend of mine, a kiddo that was willing to get out there with his rare form of brain cancer, DIPG, and talk about living every day, making it the best day ever. We lost him, I think, last Friday, and he'd been with us just the Monday before. Remember, he showed up to ask everybody to wear masks, and he made that choice. You think that David's days sadly were numbered, and he chose on one of them to come here and to try to help me and to try to spread the right message to everybody else. He's a hero from this pandemic and before that we'll remember. I'm also about to head to a visitation for my Aunt Marianne, who gave over 30 years of her life to public education. She is the youngest on my dad's side of 5 kids. She lived pretty close my entire life and was there for just about every major moment. And thank God, got to have her over to dinner a week before we lost her. To her husband, to her daughter, my cousin, we are thinking about you. We are grieving for you. Thank you for every impact that you made on my life, and we're going to endeavor to be there for you in the coming days and the coming years. Folks, we've shown a lot of compassion to each other over these last 15 months. Let's make sure that we pay that forward. There's so much that we can do if we let the goodness that we've let shine during COVID shine after as well. Thank you all very much.